This is the Dumbass Guide to ABGs, and I'm the dumbass. All right. Hi, my name is Reece. I'm a critical care transport nurse and paramedic. And honestly, if I don't break down complex stuff down to like caveman levels, my brain kind of just throws it in the trash. So here's how I understand arterial blood gases. And if your brain works kind of like mine does, this will make sense. All right. Step one, we're going to look at the pH. Now, what the pH tells us is if it's either acidotic or alkalotic. Once you know what the pH is, you've already solved 90% of the problem. All right, let's take a look. Our normal range, 7.35, 7.45. That's it. That's all you need to know if it's acidotic or alkalotic. In step two, we're going to figure out who's to blame. It's either going to be CO2 or bicarb. So remember, now you know pH. If it's low, it's an acidotic problem. If it's high, it's an alkalotic problem. You don't have to worry about that anymore. Now we go to CO2 and bicarb. CO2 is acidic. So the higher the CO2, the more acid. The higher the bicarb, it's more basic. Okay. So bicarb is basic. Now, let's put that into practice. Okay. So you got to figure out, is your problem a respiratory problem or is your problem a metabolic problem? Okay. Remember, CO2 is your acid. That is the respiratory system. Bicarb is your base. That is a metabolic system. Okay. So whichever one matches your pH is the guilty one. Okay. So let's think about this in examples. So if we have a low pH, remember that is acidosis, and a high CO2, remember CO2, the more CO2, the more acidic. So low pH acidosis, high CO2 also acidosis. Both of those together make it a respiratory acidosis. Think about it. CO2, if it's the guilty party, it's respiratory acidosis. Now, go to the opposite side. I have a high pH. What is that? That is alkalosis. Now, I also have a high bicarb. Remember, the more bicarb, the more basic. So, high bicarb, high pH, that is a metabolic problem. And a high pH means alkalosis. So, metabolic alkalosis. So, if your pH says acidosis, you got to ask yourself, which one is more acidic? Which one's higher towards the acidic side? Okay. Now, here's where it gets tricky. We got to figure out, is the body trying to help me? So, I'm in this one directional problem. Is the opposite one trying to pull me back to normal or pull me back to homeostasis? Here's how to tell. So, if you only have one abnormal value, so if CO2 or bicarb is normal, then it is uncompensated. They both have to be abnormal for there to be any kind of compensation going on. Okay. Now, if both values are abnormal, but the pH is still abnormal, so think about it, the pH is still out of whack, and both of them are out of whack, then it is partially compensated. Okay. Now, if both bicarb and CO2 are abnormal, but your pH is back within normal limits, then you are fully compensated. Okay. So think about it. All right. Now let's lock in and let's go ahead and do some examples. Okay. First example, pH 7.25, acidotic, alkalotic, or normal. 7.25 is acidotic. 7.25 lower, acidotic. CO2 55, acidotic, alkalotic, or normal. Well, CO2 is 35 to 45. So acidotic. So there, we've already linked two of them, right? Now we look at our bicarb. Acidotic, alkalotic, normal. 22 to 26 is 24. It's normal, okay? So let's put that all together. So I have one abnormal value and I have an abnormal pH. So that is uncompensated respiratory because the CO2, acidosis because the pH is low, okay? Uncompensated being the bicarb is within normal limits. All right, example number 2, pH 7.38. Is that acidotic, alkalotic, or normal? 7.35 to 7.45, that is normal, right? Okay, so now we got to ask ourselves, is the bicarb and the CO2 abnormal as well? Well, what is CO2? It's 60, right? That's high. That is very high. So acidotic, alkalotic, or normal? Acidotic. Now, what's our bicarb? 36. That is alkalotic, right? That's high. So, what are we looking at? pH, little on the lower side. 7.38 is less than 7.4, making it an acidotic. Remember quotations because it's compensating. Acidotic problem. Which one is making it acidotic? Well, the CO2 is super high, which is acidotic. So we have a respiratory acidosis. Now we got to look, are we compensating? Both our bicarb and our CO2 are abnormal. So we are fully compensated because our pH is within normal limits. Okay. All right. Remember, normal pH, but leaning acid, CO2 and bicarb are both abnormal, fully compensated respiratory acidosis. All right. Let's recap. Let's hone it on in. Okay. Step one, look at the pH. Acidotic, alkalotic. That's how you know. All right. Step two, who's at fault? Is it the CO2's fault or is it the bicarb's fault? All right. Step three, is the body trying to fix it? Yes or no? If it is, it's compensated, either partially or fully. And if no, then it's uncompensated. The body doesn't care, right? Remember, don't memorize stuff. Like, try to understand it, make it make sense. Because I can't memorize stuff like crazy. So if you make it make sense, it'll last longer, right? All right. Please hit subscribe if you want more no BS breakdowns of stuff. I try to make scary stuff a little bit easier for people like me. So let me know if you guys have any questions in the comments. I'm happy to answer. All right.